that make you feel weird, scared, and afraid? Well, it's not your dentist's fault because they went to dental school. And in dental school, we are taught to talk really, really weird. You may have a hygienist as well. She's also taught to talk that make you feel weird, scared, my name is Dr. Well, it's not your dentist's fault, and I am helping because they went to dental school hygienist and everywhere.
Oh, I'm hearing
not
everything
talk
twice.
weird.
It's good now, right? We're okay now, Morgan?
Yeah, it's good now. Thank you.
So I've come up with 5 words you should not say in a dental office. 5 words that will make your patients feel scared, feel weird, feel afraid, and make you unlikable. So what are these 5 words? So we're going to go through don't say this, say this. The first word is fail or failed. There's no reason we have to look at a patient who's had a bridge in place for 20 years and say, Millie, your bridge has failed. It's unlikable, it's mean, and it doesn't even make sense because cars don't last that long. So instead of failed, how about we say this? Hey, Millie, it's time to replace your bridge. So don't say fail, say replace. What's next? My personal favorite, the one that makes you feel so weird on the inside when you say it. If a tooth does not have a filling, we are taught to call those teeth virgins. Does that make you feel comfortable to hear the word virgin? Instead of saying virgin, how about saying tooth without a filling? This tooth doesn't have a filling, not that it's a virgin. The third thing is save. We often say to patients, we can't save this tooth. So dramatic, like it's Private Premolar Ryan and Tom Hanks is coming to save it. So instead of that, say, hey, the cavity here has gotten so deep, we cannot maintain this tooth. So to review, don't say fail, say replace. Don't say virgin, say tooth without a filling. Don't say save, say maintain. We have 2 more. Informed consent, so dramatic. I'm going to give you an informed consent for a root canal. Now, what could you call an informed consent? A heads up. I'm going to give you a heads up what can happen. So you can have an informed consent form where it says informed consent, but as you bring it to life for patients, say, I'll give you a heads up. Most of the time things go really, really well, but these are some things you should know about your procedure. I'm going to give you a heads up, whether it's a root canal, scaling and root planing a crown. And the final one is the P word. Do not say this P word. And that P word is policy. No one likes to hear that word. You don't like it, I don't like it, and our patients don't like it. So you may have a financial policy where everyone pays before treatment. That's cool. But instead of saying policy, why don't you call it protocol? So don't say policy, say protocol. So these are the 5 words you should not say to be less weird and more likable in the dental office. Don't say fail, say replaced. Don't say virgin, say tooth without a filling. Don't say save, say maintained. Don't say informed consent, say heads up. Don't say policy, say protocol. If I can help you in any way, just reach out to me at dentalnachos.com. It is my life's goal to help you talk less weird. Give me some sort of either a sign like this and I'll go. We are taught to talk really, really weird. Virgins. Private Premolar Ryan and Tom Hanks is coming to save it. Really, really weird. One of my favorite parts about being a dentist is helping patients chew and smile with confidence using dental implants. Dental implants are an amazing tool that we can use to replace one teeth or all of your teeth. We can use them to stabilize dentures and help you feel great about your smile. I would love to do a virtual consult with you to tell you more about how awesome dental implants are and how they can help you in your daily chewing life. Please reach out to me, send me a video, send me a few photos, and I would love to do a virtual consultation, then meet you in the office in person.
Dentures without implants are for smiling, not chewing. One of my favorite patient communication tips. This is Paul, Dr. Nacho, showing one of the cases we're doing today on an awesome patient. Does not have a ton of bone. So there's 4 dental implants. Here's her implant overdenture. We're doing the wax try and visit. One of the things I share is that the more implants you do, the more snap ability it has. To share the why, this patient has a resorbed bridge, as you can tell, so the more implants, the more snap. So we try this in later. If I can help you learn about implants in any way, communicate with patients, plan cases, just have more fun helping your patients chew and smile with confidence, reach out to me at dentalnachos.com or just text implant to 215-543-6454.
Are you a dentist that would like to help more patients, have more fun, make more money without working more hours? That sounds a lot like me. I'm a dentist who tries every day to do just that. Patient-centered production, help my team build an awesome, positive environment in our office, be as productive as possible, but not work more hours, because dentisting hours, they're a bit like dog year hours. As Paul, Dr. Nacho Goodman, I've created a program to help with this. I'm going to share with you about this program and also the 9 words to millions of dollars. If you just watch this and learn these 9 words, you can produce millions of more dollars.
Hey, everybody, is Paul Goodman. So excited to be here for Implant Dentistry with case acceptance chips. Develop your implant core as a general dentist to improve patient care and production. I want to share our checklist, our learning objectives, then talk with you guys. Learn effective consultation techniques to increase case acceptance. Discuss surgical skills needed to place dental implants and the value of extraction and bone grafting. Identify restorative techniques to decrease stress and improve patient outcomes. Discover the role of the general dentist in implant dentistry, and learn a case selection protocol that identifies straightforward implant cases. But the most important person here is you, the second most important person, your future patients and team. So I'm going to get to know you guys in a minute, but just as we get settled in here, before we start talking, we're going to have a combination of some videos, PowerPoints, me talking to orient you to what we're going to learn tonight. So I'm going to bring up a video here in a second. While we're watching the first few minutes of this video, would you please put in the chat your name? What's one thing you would love to learn tonight? What's one thing you would love to learn tonight? And how long you've been a dentist? Your name, what's one thing you would love to learn tonight? And how long you have been a dentist? And we will get started with this video in just a second here. I have a saying, the sign of a messy desktop is the sign of a genius. So let's stop this here for just a second. Okay. Great.
In your dental career in a patient-centered way. I live by this mantra. If it doesn't help, it doesn't matter. Patient-centered production can help the patient, the team, and most of all you. But how do you unlock this ability to get treatment plan acceptance? Dental school does not teach us to do this, but we can at Dental Nachos with our Fundamentals of Implant Dentistry program with case acceptance chips. But I have a special assistant here who's going to help me with the 9 words to millions of dollars. Could you bring our fancy technology over, please, moderator? You want to come say hello? Can you say hi to everyone? Oh, this is the moderator of Dental Nachos. I have a question. Why aren't you in school today? Because of the virus. Because of the virus, school is now in our house. So it is a nacho nuts time on earth. So whatever we can learn to make things less nacho nuts would be helpful. So this is the 9 words to millions of dollars. What we have here is a missing 2 space. Moderator, can you hand me the red marker? Thank you. Great job. So what are the 9 words to millions of dollars? We have a patient with a missing tooth. I draw just this for the patient, okay? And I say, hey, my job is to tell you what happens if you do nothing. If you leave this space be, nod to Dr. John Coyce, who helped me learn that early in my career. Patients do not accept solutions to problems they do not have. An amazing piece of advice. So we need to create problems for this patient with this missing space. So I also say, after I review all the menu options, just like a restaurant, even if you decide to do nothing, we can still be friends. Always gets a laugh, diffuses the tension, but I want to share with them, here's what happens if you do nothing, select no treatment. First 2 words to do this, but we can at Dental Nachos. Can you say, I have here is just this for the patient, okay?
So I like to deliver immediate value. So I've been doing this for many years, and this is one of the best things I can share with you. You cannot do any implants unless a patient says yes. So consultation techniques should start with what happens if you do nothing. Thanks, Dr. John Coyce. I'm going to draw out what I draw out for patients, have done for years to help them move forward. The consequences of no treatment. Start with that. Share with your patient, hey, even if you decide to do nothing, we can still be friends. Now, Kimberly Carey is my favorite part because she put in the chat her name, what she wanted to learn about, how long she's been practicing. So I also see, I know Jay's on here, Simi, Maria, my friend Maria, and Lisa. Put in the chat your full name. You can put it for everyone, how long you've been practicing, and one thing you'd like to learn tonight. And here's our effective consultation technique coming up right now. You guys also, if you're part of this private program, got a whole series as what your awesome practice owner, Dr. J, purchased for you. So my team has sent that to you, codes to get, so you can watch on-demand, see content all the time, watch it on your Peloton, watch it while you're folding laundry. It's great to learn on the go. You can watch it from your phone at any time. So I see Lisa, good 2.5 years. Awesome. Good job, Lisa. You did it. Learn how to get patients to say yes. We're going to go over that right now.
I say, hey, my job is to tell you what happens if you do nothing. If you leave this space be, nod to Dr. John Coyce, who helped me learn that early in my career. Patients do not accept solutions to problems they do not have. An amazing piece of advice. So we need to create problems for this patient with this missing space. So I also say, after I review all the menu options, just like a restaurant, even if you decide to do nothing, we can still be friends. Always gets a laugh, diffuses the tension, but I want to share with them, here's what happens if you do nothing, select no treatment. First 2 words of the 9 words, this tooth here is going to super erupt, but I don't say super eruption because no one cares about super eruption. We'll tell you what word I use in a second, but not a dentisting word. This tooth here is going to mesial drift, but I also don't say mesial drift because no one cares about mesial drift. They care about what mesial drift means. I'm going to tell you that in a second. This here, bone is going to atrophy, but I don't say atrophy. I say something different. This tooth over here may break down. I ask the patient, what's your favorite sports team when sports are allowed to be played? Right now, the NBA is in a bubble. It's kind of all we got. If the Sixers had 5 guys, even though they've been eliminated from the playoffs at this point, if they had 5 players, 5 on the Sixers, 5 on the Lakers, and the Sixers lost 1 player, those players on that team would get tired and break down, just like your teeth without missing one of their players. So what are the 9 words here? Tooth up here, falls down, not super erupts. Tooth here, tips over. Bone shrinks. Other teeth break. So if you make your missing tooth, not implant, missing tooth consultations about the 9 words to create.
So there it is. I put in the chat, effective consultation techniques. Tooth above it is going to fall down. Tooth behind it is going to tip over. Bone shrinks, other teeth break. Hey, Mrs. Smith, you're missing this tooth here on the lower right. I want to go over with you a few things that can happen. If you leave it be, even if you decide to do nothing, we can still be friends. Tooth above it, fall down. Tooth behind it, tip over. Bone shrinks, other teeth break. Raise your hand if you think you can say 9 words to patients, because you can say those 9 words to patients. You will get more patients to move forward. When you create a problem for a patient and share with them what happens if they do nothing, they will lean forward and pay attention. So now I'm going to ask you nicely. We started our intro there. I delivered value, 9 words to millions of dollars. Who would like to turn on their video? You can do it. Turn it on. We'll talk together. Don't everyone turn it on at once. Who wants to turn on their video? Thanks, Dr. J. Where are you hanging out? Morgan, thank you. Anybody else in the video turn on time? Lisa, awesome. Good. So Lisa, I'm going to ask you to start. How long have you been a dentist? And what is one thing you're looking to learn tonight?
2.5 years and looking to get patients to say yes to implants, especially if I do them.
So tell us, so looking at patients, have you asked patients about implants before in the past?
Mm-hmm.
And what are some of the objections they had to moving forward?
Not wanting to go through a surgical process, money, time.
And so let's say I'm your patient. I'm like, hey, Dr. Lisa, you're super nice, but this is too expensive. One tooth, $4,000, one tooth, $5,000, too expensive. What do you say?
Create value in the fact that down the line, it's probably going to cost more, especially if like the one tooth breaks or the other tooth start to tip over or lose
So did those
bone.
words sound helpful to you? Do you think they'd be helpful to you?
Mm-hmm.
So it's simple strategies for success. So people have objections. Morgan's here on a Dental Nacho sponsor team. Jay, you think when we ask a company to sponsor Dental Nachos for $10,000, they say, okay, no problem, I'll take out my check and pay? Or do you think they give some objections? Why is it so expensive? Are you going to do a good job? What do you think?
Most commonly, I would say 90% find a way to not do it and object to it.
So this is it. Lisa, I love what you said, creating value, but I want to enhance that. So a lot of people say create value, but creating value is more about us, the dentist. I want to tweak it to, instead of creating value, this helps Morgan with sponsors too, share how it will impact their life. And you think it's similar, and it is, but here's what I will say. Someone says it's too expensive. I'll say, we eat 1,000 meals a year, Millie. If you use this tooth for 10 years, that's 10,000 meals. That's a pretty good deal per meal, right? Good deal per meal. I also say that, you know, when you go to your granddaughter, I'll say something, I'll match it to their life situation, right? You go to your granddaughter's wedding, your granddaughter's recital, you want to be able to eat just like everyone else. One tooth missing isn't a big deal, but just like I remind them those 9 magic words, if other teeth start to break down, have you seen, Lisa, patients who've lost one tooth that's caused a domino effect to losing other teeth? Mm-hmm. But then also, you're not going to win them all either. Just be you, share that, share how it impacts their life, share how it really is. So I like that, Lisa. Jay, Lisa, there's other people here. What about Maria? Maria's my resident from Einstein. You hear, Maria? You can unmute yourself. Nothing's going to happen.
Hello.
Hey, Maria, how's it going? How long have you been a dentist for?
Well, I've been a dentist since 2002, Paul.
2002, okay. What would you like to learn tonight?
I want to learn basically how to increase case acceptance.
Case acceptance, what are some of the challenges that you have?
Pretty much people cannot afford it, and also the surgical aspect of it, not wanting to go through that.
So one of the things, and Lisa made a good point, if somebody wanted to go through surgery, that would be kind of weird, right? If a patient goes, hey, I'm so excited to have open flap debridement, I would refer them to another dentist because that's strange. So just expect that type of resistance. But here are two people. So I always say AATI, always about the impact. And as we shift to discussing the surgical skills you need to place dental implants, which is make a flap, suture it back together, drill in a straight direction. Here are two people from the My First Implant course. Let's take a look at them. You guys can stop your video for a few minutes. You don't have to stare at us awkwardly. We'll have video on and off. I'm waiting to meet my friends here. I'm going to meet you next week. Kimberly, you got to turn your video on at some point. So let's check in here on these two dentists.
Oh, it's great.
Morgan, can you tell me, share computer sound good? Is it worth it to invest $3,000 or $5,000? Is it worth it to invest $20,000? Don't skip steps. That's one of my things. When you do your training, don't skip steps. Don't say, oh, I took this online course with this Nacho guy. I'm going to fly to another country and take a $20,000 implant course. That's skipping steps. Build your foundation. Online course, weekend course, small course, medium course. This is our My First Implant course. So I showed you those stories about the patients who need an implant overdenture, but I doubt any of you need an implant overdenture here. But maybe this will resonate with you because maybe you want to increase your clinical skills with placing implants, your mind skills in planning them, your word skills in describing them, and mainly your core feeling comfortable. So imagine if I showed you videos of people just like you who've done this. Does that resonate with you? Does that motivate you? And also listen to these people about the process, because this is a clinical video too. Listen about the process of how they felt about. So in the chat, what's stopping you from placing implants right now? Dr. J wants to inspire you to place implants. You're doing surgery. Lisa, tell me what's stopping you from going and placing an implant, not the cost from the patient, about you. Kimberly, put in the chat, what's stopping you from placing more implants? Maria, what's stopping you from placing implants tomorrow? We're going to overcome that today. What is the thing holding you back on this? Put that in the chat while you watch these two dentists. Placing implants, what they did. So let's take a look at these two videos here.
Awesome. Can you tell us your name and how many years have you become a dentist?
My name is Christopher Zeladon. I've been a dentist for about 3.5 years now.
Awesome. What was your first implant site today?
Today we did implant at site number 13, actually on my own mother. So thanks, Mom.
Yeah. How was your experience today?
It was awesome. Just one word, if I could sum it up, is awesome. The staff and the other doctors that were here were very supportive. Everyone was very informative, and you learn a lot in a very short period of time.
Awesome. How is Dr. Paul teaching style?
He's great. Dr. Paul is a very genuine doctor. He really teaches from the heart, and he teaches practicality, and that's very important in dentistry.
Awesome. Thank you very much.
Yep.
Thank you.
For this day, I didn't feel nervous. I mean, a little bit nervous, but with everyone around, all the mentors around you, you really don't feel alone, and you're not afraid because you have so much help and knowledge. I just placed my first implant. It was in site number 5, and it was next to an existing implant that my new friend Audrey just placed. And it is our patient's 11th and 12th implant, I think. So it's pretty good.
Just placed my first 2 implants. It was awesome. We did 2 days lecturing, had us super ready for today. I had Dr. Cho, who's like the Yoda of implants, overseeing the case. Dr. Paul was right by my side, really helpful. It was just awesome. Awesome experience, awesome day.
So make more awesome days in your dentisting life. Maybe it's not only just implants, maybe it's sleep apnea, maybe it's restorative, maybe it's endo, but challenge yourself to get out of your comfort zone some in a responsible way to grow so you can keep doing that thing that I talk about. Help more patients, produce more patient-centered dentistry, decrease stress, be more profitable, and create a happier environment. Share your story through video. All of the videos that you saw have been 40 to 90 seconds. It's a powerful way to share a story. Video yourself talking about how dental insurance works and show that. You can use any of my Nacho videos on the Dental Nachos YouTube page. There's a few hundred. You can bring them up in your operatory and say, look at this guy, he's talking about insurance. It's better when it's you. It's better when you say, hi, my name is Dr. Laura. I'm a dentist in this practice. One of my favorite things to do is cosmetic dentistry. I look forward to meeting you and your family. Put that on your website. That's so powerful. Connecting with people through video, especially during this pandemic, is so critical, and you can do it. You just pick up one of your best friends in life, your phone, and start videoing that.
Awesome.
So I like checklists for success. So here's the checklist for success here.
So let's go over some of your awesome things that you put in the chat. Love if you put your video back on, like around a lecture. See you guys. I know you can do it. You'll pay more attention. I want to see my friend Kimberly, if she can, put hers on. Hey, Morgan, you're back. So we have not knowing how to read a CBCT. Really good one, Maria. So what can you do? Well, you work with an awesome dentist who can help you read a CBCT. You could take CE on reading a CBCT, or you could simply sometimes go on some of these awesome Facebook groups and search for posts about reading CBCTs, and you'll see that. So get help, get mentorship. It might be in your office with Dr. J. It might be on social media. It might be through CE. Remember, you're the practitioner that's responsible. So if you watch a YouTube video on how to scan a tooth with a scanner, that's great. But you may also want to, that's a great start, but you may also want to merge that with real CE and talking to real patients. But I am confident, Maria, that someone can teach you how to read a CBCT for implant dentistry in under 10 minutes for what you need. Lisa, fear of implant failure. So you said the F word, Lisa. Lisa, what dental school did you go to?
Temple.
Temple. So I don't know what dental school does to us. It makes us so negative. They love the F word. We tell patients all the time, your bridge has failed. Meanwhile, it's lasted 20 years, 20,000 meals. We're the only people insane enough to consider that a failure. How many of you have shoes that's lasted 20 years that you wear every day? Trick question, none shoes. You got none shoes from that, right? You may have a special bag that you only bring out for weddings that's lasted 10 years because you use it like 3 times a year. So instead of fail, say needs to be replaced. So tomorrow, when you see a crown with a cavity around it, don't say, sorry, Sally, your crown has failed. Say, hey, Sally, this has lasted 7 years. That's 7,000 meals. Great job. It's time for this crown to retire and be replaced. But back to your thing, Lisa, fear of implant failure. How many implants have you seen fail in your career, Lisa? A lot, a little, barely any?
A few.
A few. How many have you seen be successful?
A lot.
So us poor dentists, Lisa, I give you a virtual hug. What possibly makes you think that your implant will fail, your implant will not work when you see most successful? Because the titanium bonds the bone well. Next week, when we do our hands-on model work with Hyacinth, which is one implant company, there's a lot out there. learn manufacturer recommendations for drilling speed and drill sequence. And I am confident, just like putting a post in a tooth or taking an impression, you'll be able to follow those directions. Kimberly, is that Kimberly? You're here now. Awesome.
Hi.
How to manage when post-operative issues occur. That's super responsible. On my way to Washington Square Park the other day at 6 a.m., one of my highest end students from like 5 years ago said, hey, Paul, I placed an implant. The patient's coming back and the patient's in pain and the patient is upset. And we never learned how to handle complications, right? So have you noticed, Maria, dentists always project the worst, right? This patient, so I said, hey, Kimberly, wasn't her name. How about you just see the patient and let me know what happened and I'll give you some advice, right? So when the patient came in, do you think it was a massive problem or the patient was possibly over? Kimberly, your patient ever react in your life? Ever a patient overreact?
Oh, yeah.
So what I encourage you to do is post-operative complications with implant dentistry are the same for extractions. So Kimberly, if someone comes back with pain around the extraction site 3 days later, but the tissue looks like it's healing but irritated, what do? Trick question.
Yeah, we kind of just advise them that this is normal. It should reduce while they're taking their antibiotics and anti-inflammatory medication, and we'll just keep eyes on it.
The same complications for implant dentistry live in the world of extraction and bone grafting. So that if you do that, you will have confidence. Now, if a healing abutment comes off, you might have to put it back on. If there's a problem with paresthesia, right, that could be a serious thing, you would remove the implant. These are things that the purpose of this course tonight is to orient you to all the stages, give you some general overview of what to do, but I encourage all of you to take deeper dives into all of this to become more experienced, but you have Dr. Jade working with you as a mentor. So ask the person near you, just like how many years have you been a dentist, Kimberly?
I've been practicing now for 7 years.
So if your patient come on, had a crown inserted on number 30 last week, and they said my gums are irritated around the crown, would you have them come in and cut the crown off and start again?
No.
No, you know better, but maybe a dental student might not know better, and they would say, oh, geez, maybe I need to remove the crown. So ask seasoned people, and when you work with one, that's great. So I got fear of implant failure, knowing how to read a CBCT, and managing post-operative complications. All right, go back to turn your videos off. Good job. So we talked about this CE course is designed to be 50 minutes and give you guys an hour of CE, but the purpose of learning is digestible pieces of information you can use. So we did effective consultation techniques, fall down, tip over, other teeth breaks, bone shrinks, menu of options, what happens if you do nothing, partial, bridge, or implant, share the benefits and risks of each, surgical skills to place dental implants, make a flap, be able to suture and drill in a straight direction, make a flap, be able to suture, drill in a straight direction, restorative techniques to decrease stress and improve patient outcomes. Let's take a look at some of these coming up here. This is one of my favorite books, Checklist Manifesto. Highly recommend you get it. Listen to it, read it. Fantastic. 3 to 7 points. Effective consultation techniques to help patients move forward. The 9 words to millions of dollars. Surgical skills to place dental implants. Restorative techniques to decrease stress and improve patient outcomes. The ABC, always be creative, the changing role of the general dentist, and case selection protocol to identify straightforward implant cases. I intentionally made these segments 60 minutes, so these are digestible pieces of content that you can build on. You may think you want to learn so much in 3 hours, but really hour episodes, movie long type stuff, TV show type stuff, so you can sit down, watch it, and learn. This is not intended for you to learn everything about dental implants in this one episode. It's intended to motivate you, to make you think a little bit differently, and to give you usable tools that you can use tomorrow. Usable tools that you can use tomorrow. So here's one right here. Favorite thing, restorative complexity. Take a picture of this slide. You watch the video, you'll get the video. You're not always gonna listen to the video. This is a super important slide, because when we start about beginning with the end in mind, what I learned in dental school, people want a tooth. Nobody wants a titanium root. If you're gonna be an endodontist out there, that seems like a relaxing job. Nobody wants is like, hey, they got a percha color for your thing is not the way I like it. It seems so relaxing. There's no dentures, there's no adjustments, no contacts. That's really nice, right? You got a job where you don't have to check contacts, way better than a job where you check contacts like us. So how do you determine the restorative complexity? What can you do tomorrow if you are seeing a patient? Take perio probe and measure the space
for the missing tooth. If it's 8+ millimeters from the gum to the adjacent tooth, or to the occlusal to the other tooth, you're going to have a solid amount of restorative space. If it's 6 to 8 millimeters, it's acceptable. If it's 5 millimeters or less, you're going to have a problem. One of our great pediatric dental teachers at Penn would say, when you inform ahead of time, you're explaining. When you inform afterwards, you're apologizing for mistake. Maybe.
So this is one of the most valuable slides I can give you to decrease stress, increase success, and reduce the number of times you feel like crying inside a day. That's the whole purpose of Dental Nacho, is what we do. Okay, excuse me, take dentists who want to cry inside, like us often, and make us happier. So take a picture of this slide, do a screenshot, whatever you want, because this is very important to start off our discussion of identify restorative techniques to decrease stress and improve patient outcome. You know what's a really good one? Don't make a little short, fat turtle tooth. Turn your cameras back on if you're still here. Back on with the cameras. This is great. Kimberly, have you ever seen like a really long implant with a little short, fat turtle tooth on top of it?
Yes, I have.
Lisa, have you ever seen an implant that looked like a mushroom on a stick?
Yeah.
Maria, have you ever seen a case where it was screw retained and you can almost see the whole chimney of where the screw axis is because it was so teeny tiny?
Yes.
So that was bad planning, and most of the time it is so if I say it's your fault, Lisa, you're like, who's this guy to say it's my fault, right? If I go in my house right now and tell my 7-year-old it's her fault, she's gonna get really upset. So you gotta use good words, like, it's the responsibility of the person building the tooth. Sounds like you, Lisa, right? Mm-hmm. Sounds like you, Kimberly. Sounds like you, Maria. It sounds like me. It's the responsibility of the person building the tooth to identify restorative challenges before the case starts. It's not the surgeon's responsibility. So the way to get more restorative space is to adjust the bone down, flatten the bone without getting too close to the nerve, or contour the tooth on top. So I always contour the tooth on top when the crown comes back, not before, because the lab loves to build it high so you can adjust it and annoy yourself. So what I say to the patient is, I contour the adjacent teeth, the side teeth, before my impressions. I tell the patient, we are going to contour and smooth these teeth because I want them to get ready to look good for their new neighbor. Sounds nice, right, Maria?
Yes.
I'm drilling on my side teeth. I'm not drilling on them. I'm contouring, Kimberly, so they look good for their new neighbor moving into town. That sounds nicer, right? I don't need some weird knuckle amalgam to make. This is good for regular crowns too, nothing to do with implant crowns. I do not contour the opposing tooth unless it's egregiously fallen down until the lab sends the case back. Because what do you think's easier, Lisa, to adjust a zirconia crown or an enamel on 3 lingual? What do you think's faster?
Enamel on 3 lingual.
Right, so you say, I'm going to round the top, okay? And I had a case where one time, you know what the worst patient situations are? When you refer them to like 5 specialists and they go to their wife's friend's sister's oral surgeon 3 towns over, and they go, oh, I got the implant. That happened to me once. It was 2 millimeters of restorative space. We had to do a root canal and crown on the tooth above it. So this is a golden Nacho slide. Kimberly, did they even teach us this in dental school? They maybe baked it in somewhere, but they didn't bring it to life like this.
Yeah.
Marie, are you motivated to measure the interocclusal space tomorrow before you plan an implant?
Absolutely.
Lisa, I know you're talented, but I don't know if you can do this. Can you take a perio probe, lie it on its side, and measure how much space it is? Do you think you can do it?
I think so.
Yeah, so that's all. You don't need anything fancy. You don't need an entire wax up. You need entire wax up and mounted models. This case has gone from simplistic to complex, and now we're outside the scope of this CE course, right? Like, if I can't cook anything, Kimberly, can you cook anything? What's your favorite thing to cook?
I do pretty good braised chicken thighs.
Yeah, that already sounds very complicated, right? I need to be like in the turkey sandwich world. So if I went to CE, like cut bread, I'm like, I want to know about paella. That's a different course. Okay? So if you need mounted models and adjustable articulators, this is single tooth posterior dentistry. Why should you focus on getting really good at planning, placing, and restoring, maintaining, and profiting from single tooth back teeth implants? What is the reason do you think I encourage you to do that? And Dr. J supporting you learn this. What's the reason? Not anterior, not immediates, not all on 4s. Why do you think?
They're the most common problem that we see.
That is the Family Feud #1 answer. I'm kind of old for Family Feud. I don't know if that show's still on. So here are the answers. Number three answer is, you got a lot of stuff to do as a general dentist. You can't do too much crazy stuff. You're never going to get good at it. You're not going to learn to do all on fours and restore them until someone refers that to you. That's three, 2 comebacks. Number 2 is your own emotional stability, because you don't want to do too challenging in cases, because you're going to take it really hard when they go sideways. And number 1, they're the most common out there. So if you just dedicated yourself to doing single tooth posterior implants, you will see that you'll be able to have more fun, make more money, contribute to the office more, and help your patients. Any questions on the interocclusal arch space before we move on? Okay, good. We can turn our cameras off. We'll come back on in a minute. Maybe you just forgot. So remember this slide. Remember this thing. Measure every restorative space before I start the case. You don't have to mount the models. You don't have to get a semi-adjustable articulator for a posterior tooth. Just take perioprobe and measure it. If you have 6 to 8 millimeters, you're going to know that's acceptable. But if you have 5 millimeters, this is what you say to the patient. Call the patient Bob Guac. Hey, Bob, just want to give you a heads up. The space here, I always use your own body. The space here, it's kind of tiny. Why is it tiny? The tooth above it has fallen down looking for its friend. So we need to get more space. Here's how we get more space, so we can build you a tooth that fits in with its neighbors, right? You wouldn't go to a neighborhood where some houses were really tall and one was really, really tiny. That would be a little strange. Most neighborhoods have houses that kind of fit together. Your teeth are the same way. Now you're telling a story about something someone can understand. So the way that we get more space is 2 ways. We can modify the tooth above it. Notice I don't say drill down on the tooth above it. Nobody wants to sign up for that. Or we can also, the foundation area, you don't say bone, we can also get some space from that. So this is a really key point for working with your specialist. If you have limited restorative space, which is your job, not the implant placer, when you're doing it yourself, who are you going to yell at? That's always interesting. Place an implant, you forget about it, you come back, it's not so great. You said, oh, who did this implant? Oh, it was me. Maybe it's not as bad as I thought. So that's always a strange Fight Club type of scenario if you've seen that movie when you're doing that. So share with the restorative specialist, hey, we need to get more restorative space here. Would you be able to remove some bone? That's what you say to the specialist, not the patient, if you have enough room to the nerve or sinus. This is so many errors happen right here. So many errors happen right here. I'd also so if this was a lecture of 40 people, I've had a chance to lecture from 2 people up to 700 people at Mark Costas' awesome event when we did that. I love answering questions. So I'll stop my video and say to you guys, do you have any questions about restorative space assessment for the single implant placer, single tooth scenario? And when you step on it, it can't uncrack. Why is there like a little mini? So camera's back on, and you guys signed our media releases, so we'll make you all famous. You might be on Nacho HBO. It's a real channel, Kimberly. We're making it. Nacho HBO. Morgan's gonna get on. So you better, if anyone wants to fix their makeup, too late. We already had half the show. Lisa, I'm gonna guess, you have friends who are not dentists, right?
Yeah.
Do they have like 10 crowns and 10 root canals in their mouth, or do they have like nothing in a night guard?
Depends.
Depends.
I have a little bit of both. Yeah, I got friends in their like 40s that have a lot.
8 crowns and a precision of potassium partial. You got a lot of those friends?
Some missing teeth friends and some bridge friends.
Maria, do your friends, when you go out to dinner or Thanksgiving, is everybody talking about their implant overdentures at age 38?
No.
No. So what's interesting is, I want to tell you why we're not good people, okay? I'll tell you why we're not good people, Kimberly. Kimberly, if I was are you working tomorrow in the office?
Yes.
So if I have to get, if I got a cleaning done in your office and they're going to come check, say Paul's ready for his check, do you hope that I have 10 fillings to do? Are you like, man, I hope this guy has 10 class 2s so I can do 10 fillings on him? Do you hope that for me?
No.
No, I prefer crowns.
I hope this guy needs a lot of dental work so I can make money. Probably not. But do you hope you don't have a job, Kimberly? Do you hope, Maria, that there's nothing for you to do? You don't hope that either, right?
No.
So I have the answer to this problem. Dentistry has somewhat done it in that the younger the generation, the less restorative work they need in general. Yes, Lisa, you might have a friend with a Mountain Dew problem. Yes, Kimberly, you might have somebody with this. But in general, most people under 40 who are seeing the dentist are not getting a ton of work done. So where is this magical thing that's happening to teeth that's going to allow us to do implants? Hundreds of thousands of them, millions of them, over the next decade and 2 decades. What is happening to a tooth? There's 3 bad things that can happen. Cavity, bone shrinks, breaks. What do you see more and more people doing to their teeth, Maria?
Fractures.
Fracturing their teeth. Kimberly, can you fix a fracture?
No, you cannot.
You know, I always like when people go, I go, hey, Mrs. Smith, they go, I got this bubble that comes up and down in my tooth. It doesn't hurt. Is that a problem? I'm like, yeah, it's a problem, crazy person. None of your other teeth do that. Do that? I'm like, no. Then they go, why didn't you see it on the x-ray? They go, oh, I just don't ever look at the x-ray. I go, you can't see it on an x-ray, right? It's a 3-dimensional problem. So fractured teeth, broken top parts lead to broken bottom are the way that more dental implants are going to be done. So this should be exciting because there's no way to fix it. We can only replace it. You don't have to hope anything bad happens to them. People are fracturing natural. What's the word for it? Maria knows my language, so I'm setting everybody up. The tooth doesn't have a filling or anything in it, Lisa. What do you call that tooth?
A virgin tooth.
That's pretty common to say to an 80-year-old, right? Just shout out virgin. Tuesday morning, your tooth's a virgin, Billy. It's a virgin. What about the one with the filling in the big back? In the back, goes out for too much bottle service. Nobody knows what happens to that tooth. So these fractured teeth are going to present opportunities. Remove teeth, preserve bone, place implant. I will want to share, since I'm a responsible speaker, responsible person, responsible educator, fractured anterior teeth are very complicated. And most likely, those should be removed by a periodontist or oral surgeon who's very experienced in bone grafting. When a tooth fractures for a restorative reason in the back, not as big a deal. When a number 9 has some sort of root canal that's gone bad, just be cautious about jumping into those cases. It's often best to partner with specialists for those. But if a number 4 is broken off at the gum line and has a root canal and it's just restoratively not, you can't fix it, those could be great cases to restore. So fractured teeth present a great opportunity. Isn't this how we should have learned in dental school, Kimberly? 3 bad things happen to us. Start saying this. It's, Lisa, you got to talk to a lot of patients each day, right?
Mm-hmm.
You got to have the systems down. Don't say fail, say replace, 9 magic words, clinical, practice management. It all comes together. Just start out. You say, people come in for emergencies. There's 3 bad things that can happen in the tooth: cavity, bone shrinks, or break. For you, Mrs. Smith, it's a cavity issue. Now they have your attention. For you, Kimberly, it's a bone shrinkage issue. It will really help you streamline your conversations. Cameras back off.
How many infection that's happening? Why is it fire? Oh, great question. I would want to know that too. The way it works. See, using on you guys. The way it works is the bugs, not bacteria, get down from your mouth through that crack down into this area here, and they're trying to find their way out. This is how we talk to patients. It's super friendly, super relatable, and it will change what patients think. So I had a good question here. I've used those 9 words in limited exam patients, asking a comp exam and started talking about other teeth they want to get treated too. Great. I love that. So friends, Dr. Todd Flake. See, this board over here, I went to friend's sister. I don't talk like that.
Take picture of this slide. It will remind you. Put it on your friend, your phone. Fall down, tip over, bone shrinks, other teeth breaks. It'll be a great reference.
I just say, hey, directional indicator hitting upper tooth, or someone from a periodontist in the patient always say, make a flap, sew it back together. Those are out.
This is one of my awesome mentors and friends, Alex Show Suturing. Make flap, sew back together. Make flap, suture back together. It's the foundation of implant dentistry. Make a simple flap, look at the bone, look at it in this picture here.
But now, from my periodontist, my colleague Alex Show, I've taught with so many times, amazing periodontist, make a flap, sew it back together. Those are Alex's sutures, interrupted sutures. Can you make a flap, sew it back together? Third skill, you're going to be great at, okay? Maybe not D1, you didn't do it yet, but you'll get it, be great at one day. Making a giant post space. You make a hole, you put something in it. That's right up the general dentist alley. I don't see oral surgeons doing that. So flap, suture, post space. Of course, there's other stuff.
people get very upset with me. They say, what about the soft tissue management and the medical complications? See, dentists can complicate anything, honestly. You could ask a dentist their favorite color. Say, what do you mean by color? You say, I mean blue. Turquoise, sky? All right, I'm done asking you, dentist. So this is how you think. What are the skills you need to place dental implants? Flap, suture, post space. Yes, there's other things, but if you're trying to train yourself.
So camera's back on. So flap, suture, drill in straight direction. Someone has medical complications. You feel like, I want a course on the medical complications and how it relates to implants. You want the course, Kimberly? It's going to start now. It's going to end in five seconds. You want the course, Maria? It's going to start now. It's going to end in 8 seconds. You want the course, Lisa? It's going to end in 12 seconds. If they have any medical complications, don't place the implant yourself. End of course. No Plavix, no Boniva, no diabetes. Everyone's always talking about every answer to a test in dental school is uncontrolled diabetes. My whole life, I never seen anyone with that. I'm glad I don't. But I just want to let you know, if someone has uncontrolled diabetes, replacing number 3 may not be their biggest problem. So if people have blood thinners, I just was looking last night at something. It's not easy to be a dentist. For years, they tell us to take people off Plavix and Coumadin. Now they don't want us to take people off Plavix and Coumadin. Lisa, if you're doing, also one of the things I'll share with you is use the same protocols you would use for extracting a tooth. It's no different than with an implant. If someone's on Coumadin, who's 75, Lisa, do you want to extract their tooth?
No.
Because if they don't stop bleeding, what are you going to do?
Panic.
Right. And send an oral surgeon. Make it their hassle. You got 2 hygienists to check who are rolling their eyes, right? So what I'm sharing is you just look for straightforward fundamental cases and rule stuff out. There's a really great course, Morgan, Google How to Speak by Patrick Winston and put it in there. Maria's known me for many years. I can only do like 3 things well. I lose my AirPods when they're in my ears. I can't but I'm very good with people. I'm very good at public speaking. None of it is natural. You think anyone comes out of the womb being able to be a public speaker? You have to take courses and you have to study techniques and you have to practice and you have to do this. But How to Speak by Patrick Winston is one of the most amazing pieces I've seen on public speaking. Do you want to be a public speaker, Lisa?
No.
Too bad. You are one already. You want to be one, Kimberly?
Sure.
You are one. Tomorrow morning, you're going to be public speaking to some guy named Jim who doesn't want to do a crown. It's going to be a 2-person audience. Your assistant and Jim who thinks you're too expensive. So if you watch How to Speak with Patrick Winston, it will really help you. It'll help you with your children. It'll help you with your friends. It'll help you with your family. But what he really talks about in the beginning of this, I've watched it over 10 times, right? Whenever I have to give a big speech, not a fun one like this where I know I can just be easy with you guys. Like I'm going to talk to 500 people in a couple of weeks. I'm going to watch it on the plane because it reminds me of what to do with my techniques. It's really important to always share what your idea is not. This course tonight, Lisa, is not about medical complications of implants. This course tonight, Maria, is not about all on 4s. This course, Kimberly, is not about how to get perfect aesthetics around a number 9. This course is about how to plan, place, restore, maintain, profit from the single tooth posterior implant. So now, and give you guys actionable tips like the movie Philadelphia with Denzel Washington, Tom Hanks, explain it to me like I'm a 4-year-old. So you see, flap, suture, drill in straight direction. Leave your camera.
Yourself say, okay, I want to learn flaps. I want to suture, make post space. And you want to pick cases that are great starter cases.
So let's talk about this case selection protocol. Great starter cases. Lisa, what tooth number might be a great starter case?
30.
30.
19.
It's not the number 1 answer on Family Feud, though.
19?
It's not.
19. You think about it. Think about the complications. Think about what you don't want to hit. So it's not the right arch for the easiest. It's definitely straightforward.
4 or 5.
3, 4,
4 or
5, 12, 3, 4, 5, 12, 13, 14, 19, 30, 28, 29, 20 and 21, the premolars have the mental foramen. So when we do this hands-on next week, I like drill stops, especially for new people or anyone, so you don't drill too far. But number 4, that's a great case. You know, use direct vision. So I'm not saying you only do those, but look for sites that are easy to access. Second molars are not easy to access. Upper anterior teeth have aesthetic concerns. The lower anterior, we have the lingual artery down there. So don't mess around with those challenging cases before you get started. Look for ones that have good width, 8 to 10 millimeters of bone. We have a CBCT, that's really helpful. Good length, 12 millimeters of bone, lots of space. So I always like, has anyone driven on 76? I was there today. Anyone on 76? Is that a good road to start your driving career out on, Lisa? No.
No.
What would happen if someone taught you on that road? You could get hurt. You could hurt someone else. But even if you made it from Philadelphia to Conshohocken, you'd get out of the car and say, I don't want to drive again, and that stinks. Because you'd be so scared and anxious, this isn't for me. So start just driving around a parking lot, number 4, with a lot of bone. Then move up to medium cases. Then you could refer difficult cases.
Let's want to be responsible. Use
Triangulation, this looks.
So this right here is
diagonal.
this is from one of my first implant courses. I had my iPhone, and these awesome dentists were placing the implant. Let's see if they're in the right position. So if you had to place an implant tomorrow, Maria, and you wanted to get in a good position and you didn't have a guide is just to help. Anyone use the app Waze, by the way? The Waze, I like it. I use it.
Yeah.
But Waze isn't always right. Waze can throw you off. You have to know how to drive a car to use GPS. You have to know how to do a flap suture to use guides. Guides are a tool. They're not something that you drill through without paying attention. So a lot of times in these courses, I'm like the human guide helping them. But let's see how these people do. You're looking to hit the central fossa of the adjacent tooth, of the opposing tooth.
So let's take a look at this quick video of lining up the implant.
Quick tip, mid-implant surgery here for some new implant dentists. If you want to check your angulation, this looks awesome from a buccolingual perspective, right down the central fossa line. And then you're going to have the patient close down gently, close down, and just retract a little there on the top, right? And so is the directional indicator or the drill, if it hits the central fossa, the upper.
So you guys are going to restore your own implants. You don't want to know yourself. If the directional indicator is missing the whole tooth to the palate, that's not good, right?
Right.
Some dentist named you is going to have to put on the impression coping in a weird way. If it's going towards the cheek, that's not good. It's got to be hitting the opposing central fossa, hopefully so you can make a screw retained crown. We'll talk more about that as in the next week in the final lectures. Screw retained crowns to me are my favorite type of crowns. I made a lot of cement retained back in the day, but first screw now. So these people did great. Let's watch another one.
You're in good shape. Just a quick tip there. We're going to keep going.
So we got it. There it is. Tells the whole story. Look, directional indication early. I'm 11.5 sometime in NBA that didn't 12 millimeters to the nearest anatomic concern. Nerve.
So even though there's CBCTs, PAs are still valuable. This one on the with the lower, that's going to be straightforward lengthwise. This one on the upper, Maria, that's going to be hard for anyone, right?
Yeah.
There's no bone. People are like, I want to know about the complications for dental implants, right? Like, can I please take a 40-hour course on it? I'm going to give you a 4-second course. Ready, Kimberly, for the complications? Ready, Lisa?
Yeah.
No bone. That's the complications. No bone. Case has no bone, refer out of office. Case has bone, or to your specialist in office. I know you guys have this, right? Case has bone, do that. I don't know. Do you do second molar retreat root canals, Lisa?
No.
But maybe you do premolars. I'm not sure if you do, Kimberly, you want to, if a child had 10 fillings to do and was 4 years old and would barely get out of their mother's lap, you're like, put them in my schedule tomorrow.
Yeah, no, definitely not.
Why do we annoy ourselves? Evaluate case complexity, which has to do with the anatomic complexity, the patient complexity. More questions, less likely I want to do it, right? I say that all the time. You have patients, Lisa, they ask 97 questions about a crown before they do it.
Yeah, I had one today.
You have patients that ask like 3 questions. 3 questions like, what's it cost? How long does it take? I'll do it. You love those people, right? 97 question asker, they never get easier. They only get more question askery. So you're a general dentist. When it comes to placing implants, stay in a zone, stay in what I call your circle of comfort, not the circle of annoyance. The circle of annoyance is where we put ourselves when we do not manage patient expectations well. Patients will tell you how crazy they are. You just have to ask the right questions. You know that. Ever a person say this, Kimberly? Are you going to be done with this soon? I have to go somewhere else. Have you seen that?
Oh, yeah.
They're never easy.
Absolutely.
No one would say that about their precious hair. They leave their kid at daycare. They don't care. Can you rush and be done? So
yes.
What I want to do at this point is Just bring my face up big. So the purpose of this was to have fun, give you information that you could use, right? Dental school learning is boring and annoying. Hopefully something you can take with you. And we stream this to YouTube. So when we stop this, Morgan will send you the link, okay? Send you the link. You can have it. You can watch it. Actually, Morgan, I'm gonna stop it now. Actually, I don't want to stop it yet because I'm gonna ask you one thing. So you can watch it. Ted Lasso, you done with Ted Lasso? Watch this. You done with Schitt's Creek? Watch this. You done with Succession? Watch this. You done with it? So, Kimberly, you never met me before, right? We never met?
Correct.
So what is one thing that you learned from my face tonight?
I really appreciated that first key slide where it's super duper simple, because that's what I think everybody's looking for, is just simple ways to stay out of the doghouse. So the probing depth measurement, like that was a huge takeaway for me.
Yeah, now you have the video. You can watch it as much as you want. Lisa, you can't use the same one. What's one thing? I know maybe there's 4 or 5 things, but what there's one thing that you think you'll think about tomorrow from this lecture without needing a reference note? Just say, I might say this, I might do this, or look at this.
I liked the cute little picture with the easy ways to say like falls down, bone shrinking. I think patients like it.
This Maria texting me still saying, oh, look, and they show me their picture on the back of the freaking patient bib. They show me their pictures. Get a whiteboard. Watch this. Do you like restoring implants, Lisa, like a number 20 implant? So if we all one day work for Amazon's House of Dentisting, which could happen, right? Kimberly, Lisa, Maria, Paul, Morgan's not a dentist. She doesn't have to hang with us. If there was 4 tables, right? Restoring single teeth implants, second molar root canals, lower dentures on people who don't want implants, and seeing kids. And we all made the same amount of money. We wore orange nacho jumpsuits. Which table would you run for, Lisa? The lower dentures, that implant table, or would you first restoring implants table?
Restoring an implant.
Right, it's fun and easy and predictable. So why don't you talk to people about stuff you like, and then crazy, it's also the most profitable thing. So that's pretty good. It's profitable, straightforward, and rewarding. A lot of the other work we do is annoying and the patients don't appreciate it. I've done fillings, I don't do much anymore. You put out like 48 things for a class 2. It's an insane percentage. They don't thank you. You ever thank you? Sometimes I'm a little older now, and I like to joke with people. I'm gonna go, stop, Bob. Do you see what we put out for you? We've worked very hard over here. So I'm sharing with you is, even if it wasn't profitable, it would still be very attractive because it's patient-centered. Implant dentistry is patient-centered first. If it doesn't help, it doesn't matter. Be proud to sell help. It's my 2 mottos. Doesn't help, it doesn't matter. Implants help, and then be proud to sell the help. If I give a course in Philadelphia that I think is valuable on how to talk to patients, $200, say, Maria, this course will help you feel more and boost your morale and boost your ability to make money. It's $200. I'm proud to sell it to you. When you have that confidence and you feel secure, not arrogant, people will notice, this is great. I'm proud to do implants. It's cool. Maria, what's one thing you would take away from tonight?
How to be more case selection.
Yeah.
Start looking out for more cases.
Next week, but just be like, oh, that one would be easy, medium, hard, right?
Yeah.
Medium, hard. Get good at refer them. I never made, one time when I was a new dentist, I did a multi-year GPR. Maria knew me then. I was very, very talented with surgery. I got to do all these.
Yes, you were.
So I was really very into it, right? One of my first patients, my dad goes, you can have this really easy implant on number 5. I went to take a surgical guide and I'm like, could you open? He's like, yeah. And he opened like this much. And you want to be like, are you familiar with how words work? Because that's not opening, right? You have to. I referred him to a periodontist just because of that. I could barely get the tray in his mouth for an alginate, or I use Silginat now, one of our Nacho sponsors. They're never easy, those people. So take the patient personality, the anatomics, the case, put it all together and look to do more cases yourself.